Welcome back to the Wound Talk series from Molnica. Mary is starting to look and feel like herself again. Her wound isn't completely healed, but knowing that she's on the right track, she feels better and is ready to continue the healing process with renewed energy. In the last episode, we learned about the fourth of our 10 essentials: cleansing and debridement. We are now at the halfway point and on to Essential 5. Treat and prevent wound infections and biofilm. The term biofilm is used when a colony is formed from one or more types of microorganisms. Mary's wound is well on the way towards healing, but that doesn't mean that the wound has passed the stage where infections can occur. The longer the wound is stuck in the inflammatory phase, the greater the risk of a wound infection or a biofilm developing, both of which can affect and delay wound healing. White blood cells defend the body from infections by engulfing planktonic bacteria and other pathogens through a process called phagocytosis. However, white blood cells are not able to defend the body from microbes that have formed and live in a biofilm environment. An infection develops due to a complex interaction between the immunocompetency of the host, the potential pathogen, and their virulence, and the environment. It is possible that a local wound infection may progress and spread to become a systemic infection. An uncontrolled and excess level of microorganisms can lead to symptoms like odors, increased pain, and high levels of wound exudate, all of which make healing more difficult and extends the healing process. Sometimes a patient will need antibiotics to treat a wound infection if it has not responded to other treatments. The clinician will need to take the risk of antibiotic resistance into consideration. So it is important to have the knowledge to identify early signs of wound infection and biofilm, and then treat them in the most appropriate way for the patient. Preventing and managing wound infections will not only help a wound to heal, it will also reduce pain, excess exudate, and bad odor related to the infection. With 5 essentials down and 5 more to go, Mary and her wound are starting to look much better. Now that we have explored why treating and preventing wound infections and biofilm is important, let's take a look at how we implement this knowledge into practice before we move on to our next essential: maintaining a moist wound environment.